Hi, everyone. Okay, that's better. So, how are you doing in these kind of not so comfortable chairs? It's nice to see your faces. I've been sitting at the back of the room really enjoying the speakers. Thanks so much. Where's Jerome? Please step out. Oh, there you are. Thanks, Jerome, and thanks so much, Diana. Fabulous. So I think we have until about 5 minutes to 4. And what I'm feeling is I'd like to get really practical for the next hour. You definitely have been convinced, I think, to the best of our ability, to recognize and value sleep. You know how important it is, but it still doesn't mean you're going to be able to accomplish it. There's so many things in the way. I know many of you have been sick for many, many years. And I want to share my own story too, because it's a success story in terms of fibromyalgia and chronic fatigue syndrome. Yeah, do you want that blind angled a little bit? Got your sunglasses? Yeah, and I have a few handouts for you, and I want to talk about a few of my favorite things. But let me tell you, I used to be a competitive athlete, and this was a long, long time ago. Let me just think about the dates. I should have got them organized in my head before I came, but I don't actually stick things in my brain that don't really need to be there. There's only so much room. There's only so much working memory, and I usually just prioritize what I need going forward. I don't worry too much about the past. But when I was at the prime of my life, now I remember, yeah, I was 38 years old. My daughter was 7. And I became very, very ill with a flu. I was just telling Annette, when I was traveling for business, I was working for pharmaceutical sales. I love my work, though. Actually, I was helping with heart failure, and I really enjoyed my work. But however, I had run the Calgary Marathon, I think, that July, and I was a triathlete, and I just loved my work. I loved my life. I was really enjoying my life, but suddenly I got this violent flu. So I don't know how your illness has come on. I know there's many different ways that it can show up. But I was violently ill, feverish, headache, wasn't able to work, wasn't able to drive, and like I said, I was traveling, I was out of town. I didn't know how I was going to be able to get home to my daughter. But we worked that all out. Over the next couple of weeks, I lost a lot of weight. I wasn't able to eat. It was quite a dramatic traumatic onset. And of course, the diagnosis of chronic fatigue syndrome took about 6 or 8 months, as it did at the time. Very difficult. I think it's a little better. It's still not great. I'm so sorry. I understand that. Thank goodness for people like Ellie who really listen well and can sort it all out. But I was in shock for about a year, and then I got sicker and sicker and sicker. I was altogether, the pain developed not right away, but over about a year. So a diagnosis of fibromyalgia a little bit later. And then in my mind, being a health professional, I was working as, like I said, exercise physiologist and cardiac physiology kind of training for myself and others in the pharmaceutical group that I worked with. I wanted to figure it all out mentally. And so I was getting sicker and sicker and more discouraged. Anyway, what happened after a time, I started investigating cognitive behavioral therapies like Jerome was talking about, and had a lot of success with that. I started to notice that I had done a lot of journaling. I was a writer. I really enjoyed writing. And then over time, I noticed that I seemed to be not needing my health professional team as much as I did before. So I thought, gee, what's happening? In terms of my emotional processing, it seems to be a really good thing. I seem to manage my pain better. I seem to sleep better. And even if I wasn't managing better or sleeping better, I was just feeling a little more in control. Anybody want more of that? Just feeling like you got things managed? Yeah, it's a feeling that you want. So it took me 7 years to sort it all out. I didn't start to get better until I accepted that I may not get better. And honestly, if I would leave one message with you, that would be it. And not saying I understand we're so unique. Everyone is such an individual. But for me, it wasn't until I stopped fighting the situation that I began to be able to focus on, well, here's what I can appreciate about being sick. Here's the good things about not feeling well. Here's the good things about getting clobbered out of my life where I didn't have my friendships, I lost all my savings, and what kind of a mother was I when I was teaching my daughter to do the vacuuming when she was 8 years old, those kinds of things. When I started thinking more about moving towards health, or just even what can I do to feel better right now? What can I do to feel better in this hour? Whether it was a nighttime hour or daytime hour, instead of I can't do this, I can't play tennis anymore, I can't go to work anymore, how am I going to support my family, those kinds of things. So it was a shift in my thinking that was really important. And then I started appreciating more about what was happening. Took me about 1.5 years to improve some of my symptoms. And the reason what I'm doing now is consulting in sleep health, helping individuals feel better in terms of managing symptoms, starting with sleep, all right? I forgot to mention, I've been with the Tom Baker Cancer Center Patient Education Program for 15 years. So had been focusing more, once I got better, I did get completely better. 8 or 9 years is what it took. And now I'm a competitive athlete again, play tennis and do ballroom dance and have all kinds of fun. It feels like I was never even ill. And so I want that for you. Like in the next hour before we leave, I so passionately want this for each one of you to just feel like I can manage a little bit today. I can do a little bit better today. And if you think that way every day, I'm not saying be positive, it's not being positive, it's just like in each moment, what can I do right now to feel better? Do I need a cushion behind my back? Do I need to just think about hugging my child or petting my animal or whatever it is you need? Oh no, I see people petting each other, that's wonderful. I love it, I love it. So what I've noticed now that I'm back working as a health professional, mainly with patients and families with cancer, is that underlying so many illnesses, and I consider cancer a chronic illness, so we can debate about that. That's not necessary though. But I was hired also with the Calgary Health Region before we became Alberta Health Services to develop a curriculum for physicians to talk about spirituality in chronic disease. So looking at all kinds of different chronic diseases, looking at cancer, looking at fibromyalgia, looking at chronic fatigue syndrome, what I was noticing that almost always underlying the symptom panel that people were presenting with was a sleep disorder. So what I know, just because of my own experience, I was thinking, what if we focus on sleep first? Very difficult. I know you're trying to manage your food, you're trying to manage your relationships, you're trying to manage your finances in your work situation. You can't do it all, it's too difficult. Why not just focus on one thing to start with? Just saying, because it worked for me, is once I began sleeping better, all my other symptoms resolved. The pain resolved later. The agony, like the mental agony that I was, still enduring because I was a type A personality to start with, which I thought was fabulous until I knew better. I thought, who needs to sleep? Like the first 38 years of my life, I thought, I don't have time to sleep. Life is too great. I'm having too much fun. But wow. So what I want to do is talk to you about the 3 things that I did that I would say really helped me the most. And these are skills that you practice, that you get better at the more you do it, and you can start tonight, and you could start sleeping better tonight. Now you're thinking, Chris, oh yes, everybody says, sure, sure, sure. But honestly, if you can just improve even a little bit tonight and a little bit more the next night, like I said, it was imperceptible for me. It took a long time to notice that I was feeling better. I didn't even want to believe it at first. I thought, I think I'm feeling better. I didn't want to say it could even be true. So it took some time, and I was nervous about it. And I was nervous for about 5 years, thinking I was going to fall ill again. So I know that you know what that feels like. But here's the things I did. All right, I started, like I said, writing before I went to bed every night. So I would encourage you to do that tonight. Who does that? A little bit of journaling before you go to sleep. Does it seem to help you? How does it help you?
Well, you get all the emotions that you write on paper, and then it takes care of it from there.
Yeah. So any painful emotion does cause actual physical contraction in the muscles. And so that's going to exacerbate your pain. You know, you're not going to solve anything with your writing necessarily. You might accidentally, but you might not. You don't even need to write properly, like with periods or punctuation, or you don't need to solve. Think about, well, what am I going to do with this, that, or the other thing? You just write. And if you don't know what to write, you can start by writing, I don't know what to write. All right? Do this on your computer, maybe 2 hours before you sleep, all right? Or just in a journal, all right? Doesn't matter how you do it. It honestly doesn't matter how you do it, as long as you're not on your computer in the middle of the night. And you've heard that very, very clearly. Very, very clearly, all right? So maybe around 8 at night or 7:30, 8:30. Just spend about 15 minutes writing. And if you need help with guided writing stems or that kind of guidance, I can help you with that too if you're interested. But you might write, for example, what I appreciated today was this. Or my biggest symptom today was this. And I wonder if I improved it just a little bit, what would happen? All right, so you can kind of guide yourself, but you don't have to. You just write about how you're feeling. If you're feeling horrible and you want to complain about anyone, traffic, do it. Just don't hold those emotions in your body. All right, so there's no fast rules about it. The second thing, oh, I forgot to tell you, when I started to get better, I wanted to learn more. I had completed a master's degree in cardiac physiology, but I wanted to explore more about complementary and alternative therapies, integrative therapies, because they were helping me feel so much better. And so that's when I went on to do a PhD. I started it online, kind of distance learning. And the study that I did for my dissertation was with 52 people who have a symptom set similar to maybe what you have. So lots of different diagnoses, people with FM, CFS, chemical sensitivity, people with cancer, people with cardiac disease, depression, on and on and on. Just a mixture of people who were willing to write a couple minutes before they went to bed. 20 minutes for only 4 days. That's all that was included in the study. And a lot of the work on expressive writing in the clinical trials are only 4 or 5 days of writing. And then assessing symptoms before you start, assessing again after maybe a week, and then a month, and then 6 months later. So in my population, this is amazing. There was a 54% improvement in physical symptoms. 54, anyone, do you think that would make a difference if your symptoms were improved by half? Would that make a difference in your life? Big time, big time. And a 24% improvement in mood and emotional symptoms, so depression, feelings of anxiety, that kind of thing. So it was a large enough study. And then with the success of it, I delved deeper into the literature. There's quite a bit of literature about expressive writing, how it can help with inflammation in the tissues, how it can help you as you're going into a dental appointment, all right? How it can help you breathe better if you have, there was improvements with asthma, there was improvements with migraine. So your physical symptoms can improve with 20 minutes of writing each time, you know, if you continue that every day, which is what I did. It may not work for you, but it is worth a try. How simple is that? You're not paying money, you're not going out, you can be in your pajamas, you don't have to see anybody, you don't have to comb your hair, you can just be comfortable, do a little bit of writing before you go to sleep, okay? All right. The second thing I recommend is a breathing exercise that we're going to do right now. We're going to try it. I call it the 36 breaths. And what I'd like you to do, best if you have your feet flat on the floor. And if that's not comfortable, just ignore it. Don't think you have to do it my way, all right? Get yourself comfortable. Just put your papers in your lap. We will be closing our eyes. Now, do we have some meditators in the room? Who meditates? Lots of people. Yeah, can I ask you, do you benefit from it? How do you think you benefit?
It's grounding and it's calming.
Feels good, right? Okay, all you need to do each day is whatever makes you feel good. Don't think further than that. Just maybe accept what you're going through. What can I do right now to feel good? All right. So the 36 breaths is actually a beginner activity for meditation. And all I'm going to have you do is breathe, all right? We're going to breathe in and breathe out. We're going to count our exhalations, okay? Each time you breathe out, you count 1. Then breathing in and out. See how far you get in your count. See if you can get to 36 breaths before you realize you're thinking about something else besides your breathing. Now, it sounds easy, but it's very difficult to do. The reason we want to do this is so we can understand, certainly it relaxes the body and it feels great, but you can see how erratic your mind is, and you can become more familiar with that. It's very important you know that. Once I started changing my thinking and recognizing how my thinking was getting in the way of me getting better, I started to improve. So it's very subtle, but it's very clear. And people who use meditation or different breathing activities will, I'm sure, agree with that. All right, so I'm going to count us through it. When you notice, let's say you're breathing in and out 1, in and out 2, in and out 3. Oh my God, this chair is uncomfortable. Oh, you got to go back to 1. All right. As soon as you see a thought go by, you're going to go back to 1. We'll just see how many you get to. It's not a competition. I can never get even to 10. Nobody can. Well, some people can. It's fabulous. All right. I just want you to try it and see how it feels. And just pay attention to the thought that comes. All right. Okay, closing your eyes, please. So when you're ready, I won't count because you'll breathe at your own rate that you're comfortable with. But just begin breathing. You know, if we had more time, we'd talk about diaphragmatic breathing and how to breathe. But you know what? You're fabulous. You've been breathing a long time. You're really good at it. You don't need to worry about anything. So I'll stop talking soon. You're going to breathe in and out, count 1, in and out, count 2. And when you notice your thoughts, just go back again. And I'll let you know when to come back into the room, okay? Beginning. If you'd open your eyes. So how did that feel? Anybody want to say how are you feeling? Sleepy.
I was counting, actually on the out breath, I count 1 and stick my finger at 1. So I really focused on my numbers.
Oh, good.
And then I went back to my shoulder was hurting and oops, had to go back to
Yeah, your pain will intrude, won't it? Yeah, yeah. It will intrude, and that's not a bad thing. I think that awareness is good. Maybe, I don't know if some of you get busy during the day and you're not really noticing how uncomfortable you're feeling. Does that ever happen to you? Yeah. And that's not good. You want to stay in your body. You want to be aware every moment, like not to be obsessed. I know that can happen too. That happened to me, where I was so sick of my body, right? Like, oh, leave me alone. Stop giving me messages. But well, that wasn't working. When I accepted it, then paid attention, you sore shoulder, what do you need for that shoulder? Then you're going to be able to, you need to know if those messages are coming. So sleepy, yeah, this can put you to sleep. Now, ideally, yeah, question, comment. Oh, good question. You know, I didn't. I typed on my computer and then I deleted it. It was horrible stuff, ugly stuff, swear words, people I loved, and I'm saying horrible things about the people I loved. Yeah, no. But it's the studies, that question comes up a lot. Like, should we be doing writing longhand? Should we keep our writing or not? And it's just a very personal thing. If you keep your writing, it's a good idea to date it and then look at it in 6 months, look at it in a year, see how things have just resolved themselves maybe, or that you're still needing to kind of tackle something. It's very interesting. Do you do some writing yourself?
Yes.
Do you keep it?
I write stories. Well, I publish my stories.
Fabulous.
I couldn't get past 3.
Good. Anybody get to 10?
I did with my fingers.
Fantastic. Well, good. Yeah, that's fabulous. Yeah, we have some.
I heard the stand, whatever's on, right? I kept going, but I heard it on the computer.
Yeah.
Can't get that noise out. Drop it out.
Yeah, there.
I don't
Hmm?
have pain, I just can't sleep.
What's happening when you're trying to sleep?
I think of stuff.
Exactly. Sleeping to me, like, oh my God, I tell people, you know, you have all day to use your amazing brain, which is fabulous, no question, but its skill set and its role is not for nighttime. Nighttime, your body, your tissues are saying, may I please relax? I'm so exhausted. All right. It's not time for anything at all in the brain. Now, I know that it happens, and this is why the writing is so important, to stop that monkey mind. All right? Extremely important. You have to just decide that it is important to not think at night, because you will think. And then you say to your mind, thank you, very interesting, but not right now. Let's do that in the morning. All right? It's a commitment.
I know.
It's a commitment.
I'm exhausted.
Yeah.
An hour last night.
Yeah.
Are you suggesting self-talk?
Pardon me?
So are you suggesting self-talk before you go to bed?
Well, you know what? I think the writing is better because there's a physical release. The self-talk is still in your head. I don't want you in the head. With the writing, either by hand or in a computer, you're doing a physical release of, you know, your tissues are actually going to become more relaxed as you clear the emotions from the body. Just staying in the head, no. Self-talk. It's just more of the same, isn't it? You're just going to get frustrated.
Well, aren't you trying to psychologically convince your body that it's not fun?
No, you're trying to relax your body. The writing is just to relax the body. It's just another relaxation technique. Don't.
Besides writing, because writing is not my preference.
Okay, so if it doesn't fit for everybody, that's okay. What about this breathing activity? We're going to do one more, all right? We're going to do the body scan. Some of you are familiar with the body scan. Have you tried it? We use this in cancer care all the time. Again, another cognitive behavioral therapy technique. So we'll try that, but I just want to ask you, if you were able to commit to just that breathing activity every night, if you just decided, I'm going to give it a try, how do you think it might change?
I've actually done something similar to that before. I don't meditate per se, but when my brain won't shut down, sometimes I'll use it to and where you start counting. And I have low OCD, so I try not to get out of control with counting. But,
I know.
It's
okay.
Sometimes it's counting backwards till you get to 1. Sometimes what I imagine is going down a set of stairs, nice wide stairs, so I'm not going to trip.
Yeah,
But going down a set of stairs to a beach.
yeah.
Or something that's
Deeper,
calm,
deeper,
and
deeper.
you just go down, and you have
Mhm.
certain thoughts intrude, but you just keep going down
Yeah,
and down
yeah.
and down. And to me, that's the same sort of as breathing.
Exactly.
Not much the breathing with that, but it's the same sort of
Yes.
inner
There's many, yeah, thanks for sharing that. There's so many different ways to do it. The whole idea is to relax the body and not think. That's all you're trying to do. It's nothing fancy. It's so simple. But what I notice in people, and I noticed in myself, I did not commit to doing it. I did not commit to doing it. Until I committed to doing it, I was going to remain in a lot of pain, all right? Simple, 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 simple. Yes?
Is it true that I've read that meditation you get more rest than sleep because your subconscious is?
Well, the studies on meditation are very interesting, and there has been work done here at the Tom Baker, fabulous work about how immune function shifts during a meditative state. So it does appear that meditation is, and this is a very skilled meditation, so I don't think we can really do it, maybe not just because we have so much pain. You have to get through the pain first, but it's very restful. Yes, you may or may not need to get into the 5 stages of sleep. That's just under investigation right now, like looking at brains of meditators, how they differ from someone in stage 3, stage 4, stage REM sleep. So to me, it doesn't matter. I liked what Jerome said. He said, look at your daytime sleepiness. If you're improving your daytime awareness, that's all you need to do. It doesn't, you know, your sleep itself will resolve the more relaxed you can be when you're trying to sleep. Like my thinking is when you go to bed, when it's time to go to bed, using all the techniques already said and managing the light, it's time to sleep. Not to think. So do what it takes to relax the body with these 3 techniques. All right? Is it rest? Is it stage 4? It doesn't even matter to me. I don't even think it should matter to you. Now, that's just my belief. Stop thinking at night, everybody. It's not time for thinking. That's all you need to remember. You just do what it takes to not use your brain at night. Your body knows how to heal. If we would just get out of the way, your body would know. Your body knows what to do. Now, maybe you're not trusting your body anymore. I totally understand that because it's a little mixed up. All right, let's try one more thing. Now, this is, like I said, the body scan. Again, if you're comfortable with your feet flat on the floor, we're just going to talk through a few pieces of it. It comes from the work of Jon Kabat-Zinn. Who's familiar with this book, Full Catastrophe Living? Who loves it? Who benefited from it? I'm going to pass it around. It's called Full Catastrophe Living by Jon Kabat-Zinn. The full catastrophe is, I have chronic fatigue syndrome, I have fibromyalgia, I'm going to live well anyway. I have cancer, I'm going to live well anyway. Do it. You have an illness, other people are dealing with other things. Like, don't let it consume your whole life. I know it's difficult. I know it's difficult. Just find the moments and live well in those moments. Gradually, they get all put together, and you're going to be feeling better. I'm going to pass, well, no, we better wait, because we're going to close our eyes. All right? Let's close our eyes for a second. The body scan, for those of you who've done it, you might get frustrated. We can't fall asleep right now. We don't have our pillows. We don't have our blankets. We're just going to do a little bit of a scan through the right leg. So all I want you to do right now is just relax for a moment and bring your attention to the toes on your right foot. The toes on your right foot. I'm not going to explain anything. Just follow these simple steps. Your attention is, let's say your little toe, your big toe, in between toes. Take your awareness to the toes. Move your awareness to the ball of your foot, so you're in the right foot. You're just thinking about your right foot. Think about the bottom of your foot. Think about the tender tissue there. Think about the top of your foot. Move your awareness to your right ankle on the outside, all right, laterally. So your outside ankle on the right side. And then still in the right foot, move your awareness to the ankle on the inside. Now think about your heel. You might feel a bit of energy moving in your foot on the right side. Now just draw your energy up the front of your leg towards your kneecap, okay? Moving your energy up, just feeling, just having the awareness of your right leg, your lower leg. At the front, think about the back of your leg, or your large gastrocnemius muscle. You've got a large muscle there. Be aware of that. Think about your kneecap now. We're moving up the leg. Back of the knee. Outside of the thigh. Bring your energy up towards the pelvis. Just feeling how your body is feeling on the right leg, on the thigh, the front of the thigh. Move around to the inside of the thigh. And the back of the thigh. And just sense how you're feeling in your right leg. How does your right leg feel generally? Compare it to your left leg. Think about that for a minute. Think about your left leg, compare it to the right, and then open your eyes. Anybody notice a difference? Gentleman in the orange, fuzzy shirt.
That leg was tighter, my right leg felt like I went a lot of air stations.
Some expansion there? It was a good feeling? Yeah. Differences? Yeah, blue. You felt your right or your left? Your right felt heavy, yeah. Kind of, did it feel like it was sinking a little bit, almost? A little denser. Anybody else? Your right leg felt lighter? Yeah, it's different for everyone. It's different. Some people will feel like a tingly-ish. That expansion can feel like a heaviness or a lightness. Some people feel cooler. Some people feel warmer. But what I want you to think about, if you could do that through the whole body, what would be happening with your body? Rhetorical question. You're probably going to be asleep. Try it. Commit to trying it. That's all I'm saying. Who's used the people who have used the body scan before at the back? What's it like for you? Yeah. Thanks. Do you want to share? Yeah. It is relaxing. Do you sometimes fall asleep? Okay. So the idea is, at night, you have a lot of things waking you up. You have your monkey mind waking you up. You may have pain waking you up. You may have a pet or a partner with sleep apnea, or you have sleep apnea and they're going, stop. They're waking you up. What else wakes you up at night? Noise, bathroom break, stress. Yeah, I used to have that in the lungs as well. What else? Hot, cold. Yeah. Okay, you know what? I don't want to hear about problems with this wakes you up, that wakes you up. I know it wakes you up. I don't care what wakes you up. You want to solve the problem and get back to sleep quickly. The more skills you can develop each time you wake to get back to sleep quickly, all right? So these techniques can do it. The second two, the breathing techniques and the body scan. Just keep repeating. If you have to do this 5 times a night, it's okay. It's good for you. Your body loves it. Your body's going, yay. Your head's going, I don't like it, I don't like it. I don't care what your head says. It doesn't matter what your brain says, all right? You're in control. The biggest thing I found for myself, I had to take responsibility for being ill. If I was ill, what have I done? To question myself. What have I done to create this for myself? What am I going to do to feel better? All right? If you focus on sleep, and I say this with authority, really, I've seen it again and again and again. If you begin to improve your sleep, your symptoms start to resolve. And then you're just going to manage better. You're going to find that you have more energy to choose better foods, or to get yourself out of situations that are environmentally wrong for you, or to manage your relationships better, manage your finances better, all those things that stress you. It's kind of just a logical place to start, so I really encourage you to do that. I'm going to show you a few of my favorite books. I'm going to pass them around. If you want to have a look at these things. Just for fun, I've got Dr. Seuss's book. Who has a sleep mask and wears this at night? What's everybody else doing? Keep it in the drawer, looking at a beautiful color. Find one that's not comfortable for you. Okay, well that's good. This is for people. Okay, so here on your little handout, I'm sorry, I shouldn't have gone over there. Sorry about that. Look, what I want you to look at is your action plan sheet in your handout. So these are the sleep hygiene things that Jerome mentioned already. Is your room quiet? Is it the right temperature? Is it dark enough? If it is not, you should be going right after this 4 o'clock, get a blackout blind or get a sleep mask. I'm not kidding, that's how important it is. When I find people who say I'm not sleeping well, I am developing pain, I have CFS, whatever, and then I visit their bedroom, if they allow me to visit their bedroom, and then I see the conditions that they're trying to sleep in, I lose a little bit of patience. I've worked with the Calgary Police Force, and these men and women, shift work was already mentioned, how high, how it changes your risk for illnesses, including cancer. These gentlemen and women make a cave for themselves to sleep in, and you should be doing that yourself. Who's done that? Who has a cave? It's dark, it's black, it's quiet. Yes. The rest of you? Right? So I want you to look through this list and see what it is that's kind of in the way of you sleeping better. The action plan on the next page is a commitment that I want you to kind of make to do these 3 steps, if you're willing to do it, and you may need help with it. But look at that list for a second. I want you to just talk to your neighbor for a quick second and say what you're going to do going forward tonight or tomorrow to improve your sleep. Want to hear words. Tell your neighbor what you're going to do. Have a look. What are you going to do? Make a decision. It's important. Okay, everybody, can you come back to the room again? Who's made a decision to do something? Yes, what is it? Just tell.
Better drapes and breathing strips for my partner.
Oh, good. That's fabulous. And when are you going to do that?
On the way home.
Your drapes? I don't know if I believe her.
Breathing strips for sure.
Yeah.
Next will be if I can find them on the way home. If not,
Yes.
I'll rig up something temporary until I can find them.
Okay, good. And you? Oh, good. You'll feel so good. I'm so happy you're going to do that. What else? What else? Just throw it out, everybody. Pardon? Oh, good, good. The body scan, you like the body scan? Yeah, what else? What else? Yes. Do it. Do it. Do it. So what piece of it can you do tonight? Can you throw like a sheet up or a blanket or something? You'll do that tonight? Yeah. Do it. Do it. Really, it's so important. Who else? Yes. Yeah. Oh, good question. Yes, the question, I'm sorry, the question is having a television in the bedroom, not watching it before bed, but watching it at other times? No. Please remove your television from the bedroom. The bedroom is for sleeping or sexual activity, nothing else. Nothing else. It's not for watching television. Because you would lie in bed and watch television? Why would you do that?
Then when you're on your bed, you're associating something else other than sleeping with your bed.
Do not have a television in your bedroom. Do not have a computer in your bedroom. Listen, if you do have a TV or a computer in your bedroom and you want to complain about pain and symptoms that are troubling you, I'm not going to be able to listen. No, I know I'm horrible. It's really the wrong thing to do. How committed are you to your health? How easy is it to move the television out of your bedroom, put it somewhere else? You can still get comfortable elsewhere watching your TV. You get all cozy and, you know, lie down or whatever you need to do. What else? Who's going to move the TV out of the bedroom? Anybody? Please do it. Your children, oh, I get so upset. Your children, please remove the televisions and computers from their bedroom. Please do it. Who's going to do something else? Anything else? Noise? Yeah, pull it out of your drawer. Listen, that mask has saved my life many times. Like if you travel, if you're in a hotel room, even a little fridge light in a hotel room, that LED light, if you can extend your sleep even 20 minutes in the morning before the light infiltrates under the mask, that's going to help you with your cycles of sleep. It will gradually resolve. Please trust me. It's very easy. What else is anybody going to do?
What happens if your body just listening for earplugs or having a mask around your head? Then what?
You can find a comfortable mask. You have to keep looking. Is your body uncomfortable not sleeping well over years and years and years and years? That's not very comfortable, right?
Right.
Yeah. You have to do what it takes. Now you can. You keep investigating the sleep masks. I know what you mean. And you know, some are too hot and some are just, yeah. The noise, there's other things you can do about noise besides earplugs if they're not comfortable in your ears. What else can you do to stop the noise? What else? Just throw it out. Don't think too much. You need earplugs because? Why?
Interruption.
By what?
Just irritating. The noises.
What noises?
My breathing.
Oh, oh dear. Oh, sweetie. Okay, you come and talk. We'll figure it out. All right. Oh, her breathing. Oh, sweetie, you can't. You have to breathe. Yes, Neil.
I found a small fan not directed at me, but across beside my bed did wonders to block out noises, things like
Just gentle noise. Yeah, white light. Yeah. Yeah. Anyway, yeah.
There's a real thing on it right now between white noise and pink noise. And I was going to ask to clarify that, or if it's important, or...
It's not important. You know, I think we get stuck on definitions and analyzing. Noise is noise. If it bothers you, you want to fix it. If it doesn't bother you, don't worry about what color it is or what sound you call it. Yeah? Okay, just a few things before you close. I'm going to stay as long as you want if you want to talk more. Okay, I do have an electronic workbook available. I was going to circulate it, never got around to it, but if you're interested in purchasing that, it's $10 and you can sign up at the back. I can download it. All I need your email and then I can download it for you. Just have a look at my website. I'm happy to help. And please take some action tonight. Very simple. Make it a priority, okay? Thanks, everybody.